Another day, another video of first aid by Best 12 Home Remedies for Crimean-Congo Hemorrhagic Fever. First aid by Crimean-Congo Hemorrhagic Fever, CCHF, is a viral disease that is found mainly in Eastern Europe, the Middle East, and Africa. It is a tick-borne illness that is caused by norovirus, a genus of the Binyaviriddae family. The virus is spread through the bite of infected ticks and contact with the bodily fluids of infected animals or humans. Symptoms of CCHF include fever, headache, muscle aches, and rash. In severe cases, it can lead to death. Crimean-Congo hemorrhagic fever is a severe illness that requires immediate medical attention. While there are no specific home remedies for this condition, some measures can help manage the symptoms and support the body's recovery. Here are some suggestions. Stay hydrated. It is important to stay hydrated when you are at risk of contracting Crimean-Congo hemorrhagic fever, CCHF. CCHF is a viral disease spread by ticks and can cause serious complications such as fever, headache, muscle pain, vomiting, diarrhea, and bleeding. Staying hydrated helps your body fight off the virus and can help reduce the severity of symptoms. Drink plenty of fluids throughout the day and avoid dehydration. If you have CCHF, make sure to get plenty of rest and talk to your doctor about other ways to manage your symptoms. Rest. Crimean-Congo hemorrhagic fever, CCHF, is a viral disease transmitted by ticks that can cause severe fever, bleeding, and even death. It is found throughout much of the world, particularly in Africa, Asia, the Middle East, and parts of Europe. Symptoms of CCHF can include sudden fever, severe headache, muscle pain, nausea and vomiting, and rash. In severe cases, the disease can lead to liver failure, kidney failure, and even death. Treatment for CCHF is rest and supportive care, such as fluids and medications to reduce fever and prevent secondary infections. It is important to seek medical attention early to reduce the risk of serious complications or death. Pain relief. Unfortunately, there is currently no known effective treatment for Crimean-Congo hemorrhagic fever, CCHF. As a result, the main approach to managing this disease is focused on providing supportive care to alleviate the symptoms and reduce the risk of complications. This includes providing adequate hydration and nutrition, as well as pain relief. Antibiotics, antiviral medications, and immunoglobulins are also sometimes used to help boost the patient's immune system. In some cases, patients may require hospitalization and intensive care to help manage the symptoms. Cold compresses. Cold compresses are a useful treatment for Crimean-Congo hemorrhagic fever, CCHF. Cold compresses can help reduce fever, relieve pain, and stop bleeding. They can also reduce inflammation and help improve circulation. CCHF is a contagious viral infection that is caused by a tick-borne virus. Symptoms include fever, headache, muscle pain, and bleeding from the nose, mouth, and gums. Cold compresses can help manage these symptoms and reduce the severity of the disease. It is important to use cold compresses only in conjunction with other treatments prescribed by your doctor. Vitamin C. Vitamin C is an essential nutrient for human health, playing a role in many bodily processes, from wound healing to immune system functioning. Recent research has also suggested that vitamin C may have therapeutic benefits for those suffering from Crimean-Congo hemorrhagic fever, CCHF, a viral infection spread by ticks. Studies have shown that vitamin C supplementation can reduce the severity and duration of symptoms associated with CCHF, as well as reduce the risk of mortality. Vitamin C is a safe, inexpensive, and easily accessible supplement that may have beneficial effects on CCHF patients. Although further research is needed, vitamin C may be a useful addition to the treatment of this potentially deadly illness. Garlic. Garlic has long been known for its health benefits, including its ability to fight infection, reduce inflammation, and lower cholesterol. Recently, research has suggested that garlic may also help protect against Crimean-Congo hemorrhagic fever, CCHF. CCHF is a viral illness spread by ticks and other arthropods and is found in many parts of the world. Symptoms include fever, headache, rash, and muscle aches. In severe cases, it can lead to serious complications, including death. Studies have shown that garlic extract can reduce the severity of CCHF symptoms and may even reduce the risk of death in those infected. Therefore, adding garlic to your diet may be a beneficial way to help protect against CCHF. Probiotics. Probiotics have been increasingly studied in recent years for their potential role in aiding in the prevention and treatment of many ailments. One such ailment that has been examined is Crimean-Congo hemorrhagic fever, CCHF. CCHF is a viral disease that is spread through contact with infected ticks or livestock. Symptoms range from fever, headache, muscle aches and joint pain, to dizziness, confusion, vomiting, and difficulty breathing. Probiotics have been studied for their potential to reduce the severity of the symptoms and shorten the duration of the virus. By introducing beneficial bacteria into the gut, probiotics can help to strengthen the immune system and reduce inflammation, which can help to reduce the severity of the symptoms. Additionally, probiotics can help to reduce the risk of secondary bacterial infections, which can further reduce the severity of the symptoms. Honey. Crimean-Congo hemorrhagic fever, CCHF, is a viral disease spread by ticks that can cause severe symptoms and even death. CCHF is found in many countries, including some parts of Europe, Asia, Africa, and the Middle East. The most common symptom of CCHF is fever, but it can also cause headaches, muscle aches, nausea, vomiting, and in some cases, bleeding from the nose, mouth, and other parts of the body. It is important to take precautions when in areas where CCHF is found, as it can be spread through contact with infected animals or ticks. Treatment is available if caught early and most people recover fully, but it is important to seek medical help if you experience any of the symptoms of CCHF. Ginger, or scientifically known as Crimean-Congo hemorrhagic fever, is a tick-borne viral disease that is caused by a virus in the family of bunyaviruses. This virus is predominantly found in the Middle East and parts of Africa, and is mostly spread by contact with infected animals or ticks. Symptoms of ginger include fever, headache, vomiting, muscle aches, and in severe cases, bleeding from the mouth and nose. Treatment is largely supportive, and there is no known vaccine or other preventive measures available. It is important to note that ginger is a serious and potentially fatal disease that must be treated quickly and appropriately. Zinc is an essential mineral that is required by the body for numerous physiological functions. It is an important component of various enzymes and proteins, and is involved in many important metabolic processes. It is also a component of our immune system, playing a role in fighting off infection and helping to keep us healthy. In addition, zinc has been shown to be beneficial in the prevention and treatment of a variety of diseases, including Crimean-Congo hemorrhagic fever, CCHF. CCHF is a viral disease that is spread by ticks and is potentially fatal if left untreated. Studies have shown that zinc can reduce the severity of the symptoms associated with CCHF and may even improve the prognosis of those afflicted by this disease. As such, it is important to ensure that you have an adequate intake of zinc through diet and supplementation in order to maintain optimal health. Echinacea. Echinacea is a popular herbal supplement that is believed to boost the immune system and provide relief from colds and other infections. It is often combined with other herbs and supplements to treat a variety of ailments. Crimean-Congo hemorrhagic fever, CCHF, is a viral infection found mainly in Africa, the Middle East, and parts of Asia. It is spread primarily through contact with infected animals, including ticks and livestock. Symptoms of CCHF include fever, vomiting, and severe bleeding. Treatment typically involves hospitalization and supportive care, and there is currently no vaccine or cure. There is no evidence that echinacea can prevent or treat CCHF. Aloe vera. Aloe vera is a succulent plant that has been used for centuries for its medicinal properties. It is believed to be effective in treating a wide range of ailments, from skin conditions to digestive disorders. It is also used as a topical treatment to soothe sunburns, cuts and scrapes. Meanwhile, Crimean-Congo hemorrhagic fever, CCHF, is a tick-borne virus that can cause severe illness and even death. It is most common in parts of Eastern Europe, Asia and Africa. CCHF is a serious, but preventable infection transmitted by ticks, and it is important to take necessary precautions to avoid being bitten. Remember that these remedies are not a substitute for medical treatment. If you suspect that you or someone you know has Crimean-Congo hemorrhagic fever, seek immediate medical attention. In conclusion, Crimean-Congo hemorrhagic fever is a deadly and highly contagious viral hemorrhagic fever that is spread primarily through ticks and other infected animals. It is a serious public health issue with a mortality rate of up to 40%. Early diagnosis, prompt treatment, and preventive measures such as vector control, frequent hand washing, and avoiding contact with infected animals are the key steps to prevent and control the spread of this deadly virus. Thanks for watching.